Our healthcare system, it's showing some serious signs of being sick. And I'm not talking about the patients. I'm talking about the workforce itself, the very people who keep us healthy. Today, we're putting the system under the microscope to figure out what's going on. Let's get into it.
So let's start with a number, 117,100. What is that? Well, in a way, it's the diagnosis. It's the projected total shortfall of doctors in the United States by 2036. That's a massive gap between the number of physicians we have and the number we're gonna need.
Okay, so that huge number leads to a really important question, right? This isn't just some abstract figure. It's about the very real possibility of not having a doctor when you or your family needs one. So where are these gaps coming from? And more importantly, what are we going to do about it?
So here's how we're going to tackle this. First, the diagnosis. What's causing the strain? Then, we'll look at the symptoms, things like burnout and communication breakdowns. After that, we'll explore the potential cures, both people and technology. And finally, the prognosis for the future.
All right, let's jump right into that diagnosis. Why is our healthcare system under so much pressure? You might think it's one single thing, but the reality is, it's more like a slow-moving but incredibly powerful demographic shift.
And this right here, this lays out a simple and frankly unavoidable reality. Just look at these numbers. More than 40% of our active doctors are over 55. What does that mean? It means we are staring down the barrel of a massive retirement wave in the next decade. Think of it like a great retirement for some of our most experienced physicians. And this isn't some far-off problem. It's happening right now. And of course, all that strain, it creates symptoms. As older, experienced doctors retire and the demand for care just keeps growing, the doctors and nurses who are left are being stretched to their absolute breaking point. And this isn't just about being busy, it has some really profound, measurable consequences.
And this is maybe one of the most alarming symptoms of all. A huge review, looking at over 30 different studies, found that more than 40% of healthcare professionals are suffering from burnout. And listen, we're not just talking about a bad day at the office here. This is a state of complete emotional, physical, and mental exhaustion from chronic stress. It's practically an epidemic within the profession.
So you gotta ask, what's driving all this burnout? Well, a huge piece of the puzzle is the sheer administrative burden. This is fascinating. It shows a direct link. Doctors who spend their own time, what they call pajama time, working on electronic health records after hours, they are almost 2.5 times more likely to be burned out. It's ironic, right? The very tools that were supposed to make things more efficient have become a primary source of exhaustion.
So when you have doctors who are burned out, overworked, just stretched thin, something absolutely fundamental starts to crack, and that's communication. This doesn't just impact the clinicians, it directly affects the quality of care that patients receive.
So what's behind these communication failures? This chart gives us a clue. Now you can see that system issues are part of it, for sure. But look at the two biggest bars here. Individual factors and patient factors. That tells us this problem is deeply, deeply human. It's rooted in things like stress, fatigue, even the very dynamic between the doctor and the patient.
Okay, let's drill down into one of the most common and maybe most damaging of these failures, when a patient feels like they just aren't being heard. When a doctor fails to listen, it's rarely just one thing. This chart shows it's kind of like a perfect storm of issues. Yeah, you can see individual behavior is the biggest single piece at 17%. But look at everything else that contributes. Heavy staff workloads, team dynamics, the clunky communication systems themselves, they all play a part in that awful moment where a patient feels totally ignored.
And if you want to know what all that data feels like in the real world, just read this. This quote from a patient says it all, doesn't it? Feeling like you're on a production line, not like a person being cared for. That's the real, human cost when a system is just too strained to stop and listen.
Okay, so we've got the diagnosis and we've seen the symptoms. The big question now is, what are the cures? What can we actually do about it? Right now, we're seeing two major treatment plans emerge. One is all about people, and the other is all about technology.
These are really the two main paths forward people are looking at to heal the system. On one hand, we can try to expand the workforce, bring in more qualified people from different places. On the other hand, we can turn to technology, especially AI, to try and build smarter, more efficient tools.
So let's quickly define what we mean when we talk about this people solution. First, you have international medical graduates, or IMGs. These are simply doctors who got their degrees outside the US or Canada. Then you have locum tenens physicians. Think of them as freelance doctors who take on temporary jobs to fill gaps, often in rural or underserved communities.
But here's the crucial thing to understand. This isn't a simple magic bullet fix. The promise, of course, is obvious. We can get more doctors into the places that desperately need them, and we can do it fast. But there's a peril too, and it's very real. These doctors can feel professionally isolated, they can struggle to get up to speed with new hospital systems, and it brings up some really tough questions about patient safety and how we oversee quality of care when the workforce is always changing.
All right, now let's switch gears and look at that technology fix. The key word here isn't just AI, it's responsible AI, and that's a huge distinction. It means that from the get-go, these tools have to be designed with good intentions, with fairness and transparency baked right in, so that they build trust with doctors and patients, not break it. And just like with the workforce solution, we're facing another major trade-off here. The promise of AI in medicine is just enormous. I mean, it could help with everything from making sharper diagnoses to automating all that tedious admin work that's causing burnout. But the peril is just as significant. The real puzzle isn't if we'll use AI, it's how. How do we build in the safeguards to make it a trusted partner? How do we check it for biases? And maybe the biggest question of all, when an AI gets something wrong, who's accountable? So all of this, the shortages, the burnout, the potential cures, it all brings us to our final prognosis. And the bottom line is, there are no easy, simple answers here. The future of our healthcare really depends on how we navigate some very difficult but very necessary trade-offs.
When you boil it all down, the future really depends on three critical balancing acts. First, it's speed versus safety. How fast can we get new doctors practicing without cutting corners on our standards? Second, it's efficiency versus empathy. Can we use AI to make things run smoother without losing that essential human touch? And finally, access versus retention. It's not enough to just plug the immediate holes. We have to build a system that makes good doctors want to stay for their whole careers.
Look, at the end of the day, both of these pathways, bringing in more people and integrating smarter technology, are incredibly powerful tools. But as we start using them to re-engineer our entire medical system, we're left with one final and I think most important question. In the midst of all the data, the algorithms, and the logistical challenges, how do we make sure we protect the very human heart of medicine?